Baking soda, also known as sodium bicarbonate, is a chemical compound with the formula NaHCO3, Na for sodium and HCO3 for bicarbonate. As its name suggests, it's commonly used in baking. When combined with acid, a chemical reaction occurs and it produces the gas carbon dioxide that leaves cakes, breads, muffins and cookies in the oven, making delectable delicacies fluffy, airy and basically delicious. Because baking soda is an alkaline substance, it has been touted by proponents of alkaline water enthusiasts and alternative medicine practitioners as being able to provide health benefits, such as enhancing digestion, detox, weight loss, amongst other beneficial effects. Because of its alkaline property, it is also used as a cheap home remedy to treat symptoms of GERD, or gastroesophageal reflux disease, a condition that gives the sensation of heartburn. This sensation is caused by acid reflux from the stomach into the throat, giving one an uncomfortable burning sensation in the chest and even in the upper throat. This is a story of how a man who regularly consumed baking soda over a long period of time for GERD ended up presenting to the emergency department with abdominal pain, vomiting, bad muscle cramps and irregular heartbeats, and almost died as a result. Mr. JN is a 48-year-old man who was pretty healthy except that he commonly experienced gastric problems. He frequently experienced burning sensations in his chest, worst after his meals or when he lies down to sleep at night. He also frequently drank alcohol, but didn't really consider himself an alcoholic. He frequents the bar with his co-workers 2 to 3 times a week after a long and stressful day at work. His job hasn't been going too well due to constantly mounting deadlines and a demanding boss, and Mr. JN was also constantly stressed not just at work but also with the never-ending bills he had to pay at the end of each month. Life was, needless to say, constantly stressful. His heartburn seemed to be getting worse, and after he couldn't take it anymore, he finally saw a doctor and was diagnosed with gastroesophageal reflux disease, or GERD. He was prescribed with antacids such as calcium carbonate pills and proton pump inhibitors, which he was told by his doctor reduces the acid production in his stomach. These medication provided JN with respite, and he was able to sleep better at night. But each time he stopped taking them, he found that the heartburn recurred and he had to constantly get a top-up of his medication. The medication, however, did not come cheap. He was advised by his doctor to stop drinking, modify his stress levels or risk taking medication for the rest of his life. JN became more stressed as he could not forego his drinks, changed the circumstances at work, and also could not afford all this medication in the long run. After all, there were many bills that needed to be paid at the end of each month. One day, he stumbled upon an internet forum that promoted a cheaper alternative method to relieve heartburn. Dissolve baking soda powder in water and drink it daily. After conducting research on the internet, he found videos claiming that a spoonful of baking soda a day provides multiple health benefits, such as enhancing digestion, cardiovascular health, prevent kidney stones among many other wonderful effects. Since it's cheap, natural and also used in baking, it shouldn't be harmful and worth a try, isn't it? He thought. The next day, he added a teaspoon of baking soda into a glass of water and drank it before breakfast. After his meal, he felt his heartburn was relieved. This must be the solution, he thought. From then on, JN took a teaspoon of baking soda every time he felt heartburn. But due to his alcohol intake and poor eating habits, his gastric symptoms became more frequent. On some days, he even had to take baking soda multiple times a day, and this went on for years. However, over time, he realized his appetite was worsening. Sometimes he developed irregular and fast heartbeats, abdominal pain with vomiting, facial twitching, muscle numbness and cramps. JN thought that it was due to his stress, alcohol intake and worsening gastric problems. Then one day, his vomiting was so intense and he became drowsy, which is when he collapsed and was subsequently brought to the emergency department. In the emergency department, doctors only knew that he had a history of gastritis, which is inflammation of the stomach. After speaking with JN's wife, He realized that he had been frequently taking baking soda as a home remedy for his heartburn and has been vomiting more frequently in the past few months. To put into perspective the amount of sodium bicarbonate JN has been taking, antacid pills in the pharmacy that contain sodium bicarbonate has a weight of 650 milligrams and contains 7.7 milliequivalents of sodium and 7.7 milliequivalents of bicarbonate. In contrast, each teaspoon of baking soda has a weight of about 5 grams and contains 59 milliequivalents of sodium and 59 milliequivalents of bicarbonate. That is approximately 7.6 times more than each antacid pill meant for relief of heartburn. And having been taking more than 1 teaspoon of baking soda per day over months, JN has been loading a large amount of sodium bicarbonate in his body. An electrocardiogram or ECG in the emergency department revealed that the electrical conductance of JN's heart was irregular. In addition, his blood test showed that his blood pH was very alkalotic and many of his electrolytes or salts in the blood were way out of the normal range. Besides containing red blood cells and immune cells, our blood also contains electrolytes such as sodium, potassium, chloride, bicarbonate, and calcium, all of which are important for the normal functioning of our body. Too much or too little of them will upset how our muscles and organs function. Due to the large amount of sodium bicarbonate JN was taking, his blood's sodium and bicarbonate were very high, while his potassium and calcium levels were very low. Our blood must be kept in a state of neutral pH, as too acidic or too alkalotic state will cause enzymes in the body to malfunction. Maintenance of a neutral pH is done by our kidneys, as it controls the balance of hydrogen and bicarbonate ions. Too much hydrogen ions in the blood and it will turn acidic. Too much bicarbonate ions and the blood becomes alkalotic. Because of the high amounts of bicarbonate JN was consuming, JN's blood had turned alkalotic. His kidneys were also working very hard to balance his blood's pH by producing urine to expel the excess sodium and bicarbonate ions, resulting in water loss. Along with passing urine, other electrolytes like potassium and chloride were also excreted by the kidneys. This resulted in excessive water loss, and JN was becoming more dehydrated with each day. With the continual consumption of bicarbonate, his kidneys could not keep up removing the bicarbonate, and his blood pH became more and more alkalotic. Dehydration also caused reduced blood flow into his kidneys, causing them to gradually shut down. With his kidneys malfunctioning, his body became inept in maintaining a neutral blood pH level. When blood turns alkalotic, it causes calcium ions in the blood to bind to proteins, thereby reducing the concentration of free calcium flowing in the blood. Hypocalcemia, or a state of low calcium concentration, causes muscle spasms and cramps, which JN has been experiencing more and more frequently. Of all the muscles in the body, the most important muscle for our survival is the heart muscle, which is particularly sensitive to changes in blood potassium and calcium concentrations. When these two electrolytes are too low, the electrical conduction in the heart muscles become irregular, resulting in the abnormal heartbeat rhythms that JN had been experiencing. Something had to be done immediately before JN goes into a full-onset cardiac arrest. Fortunately for JN, he arrived in the emergency department before a cardiac arrest began. He was immediately started on an intravenous drip of saline to replenish his deficient fluids in his dehydrated state. He also received an intravenous infusion of potassium and calcium, thereby stabilizing his heart by normalizing the electrical activity in his heart muscles. Gradually, with the rehydration, his kidney function improved. In the hospital, he also stopped consuming baking soda and both his bicarbonate levels and blood pH normalized. To treat his heartburn, he was given medication called proton pump inhibitors, which reduces the amount of acid produced by his stomach. With his blood pH and electrolytes returning back to normal, JN's vomiting, muscle cramps and heartbeat returned back to normal, and he was soon able to be discharged from the hospital. Having faced a close brush with death, JN was convinced that he should take the correct medication for his heartburn as well as reduce his alcohol intake. Thank you for watching to the end, and if you enjoyed this video or found that you've learned something useful, do click on the like and subscribe button to receive notifications for such videos in the future. As always, stay safe and healthy, and remember to only take medication according to its intended indication and dosage. A substance that is natural does not always mean that it will be harmless to our body.